All right, so I wanted to quickly discuss advocating for yourself with any health issue. But again, as a reminder, I have been diagnosed with breast cancer, triple negative breast cancer. So we have to be champions for ourselves. We have to advocate for ourselves. Do as much research as you can for your diagnosis, whether it be cancer or any other ailment. you know, do a lot of research because unfortunately, through this process, I have found that there are some health professionals that are in the field for compensation, not compassion. And it's very disheartening because you just assume that anyone that enters into this profession, that they are there to have empathy, to show compassion for the patients that they serve. But that's not the case as always. As I have quickly learned, you know, through this process, I have, in some occasions, been treated like a number and not a human being. They given out canned responses. Okay, this is what we usually do. This is what happens. Blah blah blah. Instead of actually taking you as an individual and saying, "Hey, how can we help you? How can we service you? This is what I recommend. This is why." Now, I will say my doctors have been amazing, absolutely amazing with the great wealth of knowledge and information that they've provided to me. They have allowed me to have choices of my own on my treatment plan. However, I cannot say the same for most of the nursing staff. I felt like, even though I was provided a nurse liaison that should have helped me navigate through this process, been unavailable, communication has been poor, scheduling missed due to procrastination. I've had to schedule several appointments for my own self, work tireless hours, 3 to 4 hours a day, trying to get appointments on the schedule. And just like no compassion, very nonchalant, like you'll get on the schedule when you get on the schedule type of thing. And I get it. I'm not saying that I should be the priority because I was diagnosed with breast cancer. However, procrastinating with scheduling some appointments for me led me to, things like not being able to have my port inserted by my surgical oncologist. I had to go to a different hospital to keep on the timeline that my medical oncologist recommended to me so that I can begin chemo tomorrow. So, yeah, I had to go to an entirely different hospital. I wasn't able to see my surgical oncologist because her books were full, because it was a 5-day lapse in my medical oncologist making the order for my port to be inserted and the actual scheduling or authorizing through my insurance company. So, yeah, just things like that is really troubling. You already have anxiety when you're going through this process. And I don't think, just my opinion, that the health professionals that are attached to your case should push that envelope where it's heightening your level of anxiety, which last week was pretty rough for me. Yeah, I just really kept it in and tried to keep my composure, but I was so frustrated, so disappointed. I cried every day, wondering why I wasn't important enough, for them to make sure that these things were getting done. But we're past that now. I just wanted to make this short video to say, please advocate for yourself. Don't just sit and wait like they would like you to do. Talk to the charge nurse. Talk to the patient. I reached out to my cousin because she's a nurse and she told me the correct name, but I cannot think of it at this time. But the person that's in charge of making sure patients are satisfied at the hospital. When I went in for my what did I go for? For my MRI, I was able to speak with several people, managers and things like that, just to vent and give off my complaints on what I thought went wrong and how it could be corrected. And hopefully they heard me. I'm doubtful at this point, but hopefully they heard me. Again, the hospital that I'm at is a great hospital. I'm at UT Southwestern, which is a great hospital for breast cancer treatment. And my doctors, again, are amazing. Most of the staff has been amazing, but I've had at least three different nurses that have disappointed me along this process. And I still have faith. The treatment center that I need to go to for my infusions, I stopped there a couple of weeks ago and met the staff. They seem to be great. And I look forward to a positive day tomorrow. I still have a positive spirit. I still believe in our health professionals and that the majority are there because it is in their heart to do so. Um, but yeah, it's been a ride. It's been pretty rough. I'm not complaining, but I do want to be transparent. Like I told you guys through this process, I do want to stay transparent and, just let you guys know sometimes it's a battle, but always advocate for yourself. And when something feels wrong, speak out, speak up, and, make some changes accordingly. So again, if anybody has any questions, please be sure to comment down below. If you've had that experience or if you've had a great experience or you want me to go into more detail, let me know in the comments below. I look forward to sharing with you all. Thanks.